Welcome to MedEd 360. Here we simplify medicine to help you master the essentials. Today's topic is mnemonics that make tricky medical concepts a breeze. What are mnemonics? Mnemonics are simple memory tools designed to help you remember complex information more easily. Think of them as shortcuts for your brain to recall difficult and complex lists. In medicine, mnemonics can help you quickly memorize things. So, let's dive in and explore how mnemonics can be your secret weapon for mastering medicine. The first mnemonic is for the causes of acute pancreatitis. An easy way to remember the causes of acute pancreatitis using the mnemonic Get Smashed. This mnemonic helps recall the main triggers that can lead to inflammation of the pancreas. To remember the causes of vomiting that aren't related to the gastrointestinal tract, we can use the mnemonic ABCDEFGHI. Each letter stands for a different cause, giving us a quick way to recall these factors. The ABCD2 score is a tool used to estimate the risk of stroke within 2 days following a transient ischemic attack or TIA. Each letter stands for a different risk factor. Using the ABCD2 score, clinicians can decide who may benefit from more urgent follow-up or intervention after a TIA. The ABCDE rule is a simple yet effective guide for identifying signs of melanoma, a type of skin cancer. Each letter represents a feature to look for when examining moles or skin lesions. If you're enjoying this content, hit the like button, subscribe to our channel, and turn on notifications so you never miss an update. When it comes to remembering the causes of hypercalcemia, the mnemonic chimpanzees can make it easier to recall the main factors. Chimpanzees is a quick and memorable way to review the key causes of hypercalcemia, whether for exams or in clinical practice. To help remember the causes of macrocytic anemia, we use the mnemonic Big Fat Red Cell. Each letter stands for a different cause of this condition. Macrocytic anemia can be a sign of underlying nutritional deficiencies, systemic diseases, or bone marrow disorders. Identifying the cause through history, clinical signs, and lab tests is crucial for proper treatment. To help remember the Class 1 antiarrhythmic drugs according to the Vaughan-Williams classification, we can use the mnemonic Police Department Questions Liquidman 4-Pin. First letter of every word represents a drug. Class 3 antiarrhythmic drugs can be recalled by mnemonic after drinking scotch in dark. Secondary hypertension refers to high blood pressure that is caused by an underlying condition, rather than the more common primary hypertension. The mnemonic ABCDE helps remember the key causes of secondary hypertension. Dialysis is a life-saving treatment for patients with kidney failure, and the AEIOU mnemonic helps remember the key indications for initiating dialysis. By remembering AEIOU, healthcare providers can quickly identify when dialysis is necessary to manage acute or chronic kidney failure. Hypocalcemia refers to a condition where the levels of calcium in the blood are abnormally low, typically defined as a serum calcium concentration less than 8.5 mg per deciliter. To help remember the signs of hypocalcemia, we use the mnemonic CATS, which represents the key symptoms associated with low calcium levels. Delirium is an acute, often fluctuating disturbance in consciousness and cognition. To help remember the causes of delirium, we use the mnemonic delirium. By remembering delirium, you can easily recall the common causes of this serious condition and consider these factors in your diagnosis and management of affected patients. Clubbing refers to the abnormal widening and rounding of the fingertips and toes, often accompanied by a loss of the normal angle between the nail and the nail bed. To remember the common causes of clubbing, we use the mnemonic clubbing. How convenient. The symptoms of anticholinergic toxicity can be remembered by mad as a hatter for delirium, blind as a bat for ocular symptoms, dry as a bone for anhidrosis, dry mouth, dry skin, red as a beet for cutaneous vasodilation, hot as a hair for fever. The mnemonic machine helps remember the common causes of hyperkalemia, a condition where there is an elevated level of potassium in the blood, which can lead to serious cardiac and muscular complications and is one of the most common electrolyte abnormality encountered. The mnemonic mudpiles helps remember the common causes of metabolic acidosis, a condition characterized by a decrease in blood pH due to an accumulation of acids or a loss of bicarbonate. The mnemonic strokes happen helps remember the common causes and risk factors for stroke, in which there is sudden loss of brain function due to disrupted blood supply, either through blockage, ischemic stroke, or bleeding, hemorrhagic stroke. The mnemonic morphine helps remember the key symptoms of opioid toxicity, which occurs when there is an overdose or excessive use of opioid medications. By remembering morphine, healthcare providers can quickly identify opioid toxicity and manage it appropriately, typically with the use of naloxone. The Jones criteria is used for diagnosing rheumatic fever, which is a complication of a group A streptococcus, gas, throat infection. The criteria are divided into major and minor manifestations, and they help in determining the diagnosis of rheumatic fever. The CURB-65 score is a tool used to assess the severity of community-acquired pneumonia and help guide treatment decisions, including whether hospitalization is necessary. The APGAR score is a quick and simple way to assess the health of a newborn immediately after birth. It is measured at 1 minute and 5 minutes after delivery, and sometimes at 10 minutes if needed. The Ranson criteria is a system used to assess the severity of acute pancreatitis and predict the likelihood of complications or mortality. It consists of 2 parts: the initial criteria, assessed within the first 48 hours of admission, and later criteria, assessed 48 hours after admission. FastHug is a comprehensive mnemonic that helps clinicians systematically assess critical care patients, ensuring that important aspects of care, such as nutrition, pain management, and preventive measures, are not overlooked. The CHADS-VAS score is used to assess the risk of stroke in patients with atrial fibrillation. It helps guide anticoagulation therapy decisions, as patients with higher scores are at greater risk of stroke. The TORCH infections are a group of infections that can have significant effects on pregnancy and the developing fetus. The potential outcomes range from miscarriage and stillbirth to birth defects, neurological impairment, and long-term developmental issues in the child. The Vindicate mnemonic helps in the systematic approach to differential diagnosis by covering the major categories of potential causes of a patient's symptoms. The LMOPP mnemonic can also be applied to remember the treatment approach for managing pulmonary edema, especially in an acute setting. These interventions are critical in stabilizing the patient and improving clinical outcomes in pulmonary edema. Thanks for watching. Keep learning, keep growing, and remember, MedEd 360 is here to support your medical journey. See you in the next video. Subscribe.